Why do influenza cases keep happening every year?
If you've been infected with influenza, you may think that you're immune now, but there's a high chance that you may get infected again. This is because influenza viruses have a very high mutation rate and are constantly evolving. Therefore, influenza viruses tend to change from time to time through a process known as an antigenic drift. Additionally, there are 4 types of influenza viruses, known as the influenza A, B, C, and D. 2 of these influenza A and B are known to cause epidemics in humans. On top of that, both the A and B viruses can be further categorized into subtypes and lineages, resulting in a wide variety of influenza strains. Influenza strains are different enough from one another that immunity to one strain due to past infection or vaccination may not provide sufficient immunity to other strains. Thus, even if you've been infected with influenza before, you can still get reinfected with a different strain. And this is why influenza cases continue to happen every year.
Why do we need to get the influenza vaccine every year?
Influenza vaccine is a little different from other vaccines, since we're recommended to get it annually. There are several reasons to this. First of all, our immunity from influenza vaccination tends to decline over time. So we need to get vaccinated again from time to time for optimal protection. Apart from that, as stated earlier, influenza viruses are prone to mutation and are constantly changing. Hence, there may be different influenza viruses circulating during every influenza season. Different influenza strains require different versions of the vaccine. And this is why we need to take the vaccine every year. To prepare the influenza vaccine for the upcoming year or influenza season, vaccine experts will determine which strain or subtypes are most likely to circulate during the season based on continuous surveillance of the virus. Then 3 to 4 most likely strains will be selected to be included in the vaccine. Since we don't have an influenza season in Malaysia, the rule of thumb is to use the latest formulation available.
Can women who are pregnant or breastfeeding get the influenza vaccine?
The short answer is yes. Pregnant or breastfeeding women can and should get the influenza vaccine. Studies have shown that it is safe to get the vaccine during any stage of pregnancy or breastfeeding. By getting vaccinated, mothers will not only protect themselves against influenza, but also their newborns. This is because the antibodies produced in their body after being vaccinated will pass on to a fetus in the womb and through breast milk to the baby. Hope that answers some of the questions that you may have on influenza and influenza vaccination. To learn more about vaccination, child health, and related topics, please visit the Positive Parenting website, as well as our social media pages on Facebook and Instagram. Thank you for watching.